So when a patient's referred for radiotherapy, we would see them in consultation. That consultation can last quite a long time because there's so much information to cover. I think one of the main reasons for the consultation is to really educate the patient about his disease. Typically, the patient is there with their spouse and maybe several family members. And we discuss how the radiation therapy is delivered. It usually is a course of treatment over about 8.5 weeks, most often. It's done with radiation from the outside or external beam radiation. Multiple beams target the prostate gland. The beams converge on the prostate gland and give a very high dose to the prostate gland and very little dose outside of the prostate gland. This is done with two main technologies, one being intensity modulated radiotherapy, which is simply a way to very elegantly conform the radiation dose precisely to the prostate gland with a margin, very much like the glove of a hand. The second technology we use is daily image guidance, in which a CAT scan is obtained on the treatment unit, what we call a cone beam CT, and that enables us to ensure that we're actually on target. In other words, that we're actually lined up on the prostate gland, because the prostate gland, of course, moves depending on how much urine is in the bladder in front of it or how much gas or stool in the rectum behind it. So we want to know exactly where the prostate gland is at the moment of treatment. And by combining intensity modulated radiotherapy, where we shape the dose very conformably, and daily image guidance, we can give a very high dose to the prostate gland, far higher than we were able to give decades ago before we had these technologies. And with that higher dose, we get better tumor control and less side effects because there's less normal surrounding tissues exposed to that high dose, namely the bladder and the rectum. So most patients I treat get through treatment fairly uneventfully. Even in their last week of treatment, most patients really aren't complaining of too many side effects.